evening, everybody, or good afternoon. I'm coming on here today, y'all, about a very serious situation that's going on. I was watching a video from a lady named Valerie Granville, and it was called Please Help. And it was in reference to a young lady that I met on Facebook. Her name is Teresa Richardson. And she has a little boy, a son, and his name is Corey. I mean, he's the cutest little boy. He's only 3 years old, y'all. And he has cancer. So, of course, that really touched my heart, y'all, because if you've never experienced it, you really don't know how difficult it is. You can only imagine. But I've actually experienced it, okay? So, I really connected, you know, emotionally when I heard the story about the child having cancer and the cry out for help. So I'm doing a video just to bring the awareness to those of you who are out there, and also to cry out for help for this family. Um, so first of all, I want to start off. The information that I'm getting ready to give you will be in my description box. But for those of you who aren't really familiar with, YouTube or whatever, you may not know, because I didn't know what description box and all that meant when I first got on. So for those of you who are not familiar with it, I'm going to verbally tell you. But for those of you who do know, it will be, the information I'm getting ready to give you will be in the description box. And I'm asking if anyone out there, if at all possible, if you could possibly financially help this family that's going through this situation with a 3-year-old child. Because if you can imagine the pain that it causes a mother to see her baby laying, in the bed sick and helpless, and it's nothing that she can do. She can only hope and pray for the best for her child. So, if you can just imagine that, and then the financial strain that it has on a family, because when your child has cancer, you have to, somebody, is going to be missing out on a lot of work. If you're a married couple, either the mother or the father is going to have to be off, because there's a lot of doctor visits involved when a child or when anyone has cancer. And I'm only speaking from experience. My son had cancer when he was 16 years old, and it's a lot of doctor visits. It's a lot of unexpected doctor visits, because you never know what's going to happen, with them when they're sick with cancer. So I just want to ask if anybody out there could really help this family financially. I'm sure it would be greatly appreciated, and of course, prayers, y'all. As many people as we can get to pray for this child and for this family, the better. So the information, if anyone out there can financially help this family, the mother's name is Teresa Richardson, and her PayPal link is Resa Richardson. So that's Resa Richardson, and her email address is Teresa M. Richardson. So that's Teresa, middle initial M, Richardson, 5 at gmail.com. So that's Teresa M. Richardson Teresa M. Richardson 5 at gmail.com. And also, they're also on Facebook. If you could go on Facebook and click like, it's called Coki's World on Facebook for the little boy Corey. If you could click like for Coki's World on Facebook, that would also be appreciated. So again, everyone, this information will be in my description box down below. And if anybody can do any kind of financial help, I'm sure it would be appreciated. But yeah, I really do understand, what this mother is going through, because, like I said, y'all, my son is now, he will be 23 in probably like the next week. But he was 16 years old, okay, when he was diagnosed with cancer. He had nose cancer, and it was called nasal pharyngeal carcinoma. Carcinoma, I'm sorry. And how we found out that he had cancer was because he had a cold. And you know how when you get a cold and you congested, and you know sometimes your glands stick out, if you have a cold. But then eventually, once the cold is over, whatever, they'll go down. Well, his gland didn't go down. Okay, so I took him to the doctors, and they said just give it, a little bit more time, and it should go down. Okay, fine, it didn't go down. So I took him back to the doctors, and they had scheduled for him to have a, um, I'm sorry, y'all, I forgot the name of it, but it's a thing where they take a little piece of the tissue from the gland or the tumor or whatever it is, and they look at it under a microscope, and I can't think of the name of that test right now. And they did that. They did that test, and it came back negative. Like it didn't show anything. Okay, but yet and still, this gland was still there. So I, went back to the doctor, and I said, something, we got to do more because this is. I mean, it was big. It was just like very noticeable. So they referred us to the ear, nose, and throat doctor, where they actually stick a scope down through your nose. And once they did that, they were able to actually see the cancer. And it was called nasopharyngeal carcinoma. And if you can just only imagine the drop that my heart and my stomach had when I heard the word cancer come out of that doctor's mouth. I'm telling you, it changes your whole life. I mean, I cried. I just went through a lot. My family, went through a lot as a result of this. And so, of course, he had to, and they had to do, start up a treatment plan for him. And his plan was to have chemo and also to have radiation. And also, my son was having nosebleeds during this time. And towards the, once they found out what the problem was, and they, he got in the hospital and they were going to start his chemo. I mean, his nose started bleeding to the point where it wouldn't stop. Like it would take a long time for the nurses and doctors to actually stop his nose from bleeding. I mean, his nose got bleeding really bad at home one day. Like actually, before we knew he had cancer, he was having nosebleeds. I'm sorry, I'm gonna back up a little bit. Before we found out that he had cancer, we just knew that something was going on. He had a really bad nosebleed in his sleep, and he had swallowed so much blood that once he got up, he actually threw up, like totally threw up, like a puddle of blood. And of course, when somebody throws up blood, that's usually a sign of something serious. So if you could just imagine the scare that I had when my son threw up all this blood, and I had to call an ambulance, and then finally they figured out what the problem was. He had nose cancer, and those nosebleeds became very uncontrollable until he started getting his treatment. So he ended up getting chemo, and he ended up getting radiation. And chemo, for anybody who don't know, chemo and radiation is very hard on. I'm gonna just say on my son, it was a rough time. I don't know what radiation and chemo will do to everybody, but I know what it did to my son. And it makes you very sick, and you lose a lot of weight because you can't really eat. So it's hard, and some people lose their hair, and thank God, my son did not lose hair. The hair that my son lost, believe it or not, and this was only after he started getting the radiation. Right here, he lost a little patch of hair right here because the tumor, the cancer was right here. That lump was right here. It was the back of his nose, but it stuck out right here. So he lost a little patch of hair at the end, the nape of his neck. That was it. So, so we was blessed in that sense that he didn't lose all his hair, but I'm telling you, a lot of doctor visits, people. Radiation alone, that's a daily visit, Monday through Friday, every single day for 6 weeks straight. He had to do radiation every day, Monday through Friday, 6 weeks straight. And then, like I said, the unexpected visits to the doctors because that chemo makes them sick. And the radiation, is really hard on. It was hard on my son. I'll just say that. So but it could really put a strain on the family financially because, like I said, it's a lot of doctor visits, it's a lot of unexpected doctor visits, and somebody, between mom and dad, if there is a mom and dad, you have to take turns. You're gonna miss time from work, and it's just a financial strain. And so, from my understanding, from watching Miss Granville's video, they have to wash this child's clothes separately. So that's detergent. Laundry detergent is expensive. The child has to wear diapers because his urine can't touch, any of the family members. And so diapers are expensive. If you can imagine, if you've been buying diapers since your child was born, and he's 3 years old, and you have to continue to buy diapers, honey, that's expensive. We all look forward to the day when we don't have to buy diapers anymore. But this family, because this child is sick, they still have to purchase diapers, and it's hard financially on any family. Just from my experience, when you have somebody that gets diagnosed with cancer, they need a lot of home care. And if anybody can help this family, they would truly appreciate it. And God bless whoever contributes to help this family. And please pray for this family. So once again, you can go to the PayPal link, Resa Richardson, RESA Richardson. Email Teresa M. Richardson5@gmail.com. And also go on Facebook and like Cookie's World. And like I said, I will have this information in my description box for anybody that's willing to help financially. And if you can't help financially, just pray daily for this child and for the child's family, because it's not only hard on the patient, but it's also hard on the family. So I thank you all, and God bless you all. And you all have a good evening, and I'll see you all in the next video. Okay, thank you. Goodbye.